I'm here with founder of For Cura for Moms, Charles Johnson, and we are talking about something super special and near and dear to his heart. And I want you all to hear about his incredible story, his incredible organization, because it's something we all need to hear and, just be aware of. And Charles, thank you so much for joining me today. And how are you feeling?
Listen, I am just feeling excited. It is Black Maternal Health Week 2023. So thank you for taking the time and just giving us the opportunity to share with your audience a little bit about what's going on with maternal health in Georgia and nationwide and what families can be aware of to make sure they give themselves the best chance to thrive during pregnancy.
Incredible, incredible. I was wondering and hoping, are you comfortable with sharing a little bit of your personal story and how you got into this role?
Sure, sure. So thank you for that. So absolutely. So the way I kind of came to this work is completely experiential. I was fortunate enough to meet a woman that absolutely changed my life. And so my wife, Kira, was just the most amazing person I had ever met. We're talking about a woman that raced cars, that was a pilot, that was an avid skydiver, ran marathons, right? Spoke 5 languages. I always wanted to be a dad. We welcomed our first son in 2014, and we were so excited to be welcoming our second son, Langston, in April of 2016. And throughout Kira's entire pregnancy, she was extremely healthy. And so on April 12th of 2016, we walked into the hospital for what we expected to be the happiest day of our lives to deliver our second son and walked right into a nightmare. And for the interest of time, um, almost 7 years later, it's still really hard to comprehend. Kira was allowed to bleed internally for more than 10 hours while myself and my family begged and pleaded the staff at Cedar Sinai Hospital to validate our concerns, to do something, and our pleas for help fell on deaf ears. Um, and so I'm always transparent about the fact that when we walked into that hospital that afternoon, the thought that my wife would not walk out to raise her boys, it never crossed my mind. But as the days went by and they turned into weeks, in months, I began to hear other stories, stories of other women who had had tremendously traumatic birthing experiences, and then even more stories of other women who had unfortunately lost their lives and made the ultimate sacrifice giving the gift of life. And that's when I began to do the research myself and came to understand that we are in the midst of a shocking maternal mortality crisis right here in the United States. And I'll share a couple of facts that may be kind of mind blowing for the audience today. One, more women die from pregnancy and pregnancy related causes right here in the United States than any place else in the industrialized world, right? We are not only the most dangerous country to give birth in, but we're the most expensive. We spend more dollars per capita than any place else in the world, right? Um, what's even more shocking about this is that the CDC has determined that 60% of these deaths, I'm sorry, 80% of these deaths are considered preventable. So these are mothers that should be there at the first day of kindergarten, should be there screaming at soccer games on Saturdays. But we can't have a substantive conversation about the maternal mortality crisis without addressing the manner in which it is disproportionately affecting African American women and women of color. Black women in the United States are dying 5 times as often as Caucasian mothers. And so that's what brings us here to Black Maternal Health Week 2023, working to raise awareness about this and then focus and center solutions and resources to make sure that families have the best opportunity to thrive during, before, during, and after pregnancy.
That is really just such a incredible story. And of course, I am sorry for your loss.
Thank you.
And you have been able to turn your loss into bringing positive power forward for mothers everywhere with your organization, as I just mentioned, for Cura for Moms. And, I just wanted to ask you some of the work you're doing with your organization. What mission do you have? And, how, aside from just mom, how are you supporting families?
That's an excellent question. Thank you for asking that. So, for us, we really try and take a holistic approach to making sure that the entire family, not just the mother or the birthing person, but her support system, everybody is empowered with the tools and the resources they need to, like I said, not only survive, but thrive, right? So, understanding pre birth warning signs. So, certain things to look out for that expecting mom may have. If she's showing signs of swelling, extreme fatigue, headaches, these are things that could be signs of things like preeclampsia, or we call cardiomyopathy issues that are affecting moms. Understanding when we get to the birthing process, when we get to the hospital, understanding how to advocate for yourself, and then understanding how to make sure that your support team is able to advocate for you in the event that you're not able to advocate for yourself. And on the other side, there's also things that we need to be diligent and look out for after the baby is here, right? Making sure that mom is okay. Somebody kind of made this wonderful, I shouldn't say wonderful, kind of really kind of blunt analogy about the way we approach birthing in the United States. And what they said was that in the United States, um, the mother is almost seen like the wrapper that the baby comes in. And once the baby arrives, they just discard the wrapper and all the attention is paid to the mother. So we've got to be more diligent about making sure that our moms are okay and we're monitoring them closely. And so we have a lot of information on our website, forcure4moms.com, where you can look for resources. And then we also have a lot of wonderful partners that we work with that are making sure that families are empowered with the knowledge necessary to make sure that they have the best chance to thrive.
Absolutely. And it's incredible because I can say from being a Puerto Rican woman, like this is prevalent in our community and it's something
Sure.
I think about a lot, and it's scary. It's really such a
Yeah.
scary thing to feel like we are already at a disadvantage medically when we feel like we're not being heard.
Right.
And it's such a journey, and it's great to know that there is an organization out there that's trying to help you from A to Z. I want to circle back on something you touched on, and it is how dangerous it is for women to be pregnant here in the United States. And specifically here in Georgia, Georgia has one of the highest maternal mortality rates in the nation. And, what can lawmakers do to combat this, or what policy changes can we, the people, bring to people's attentions or to our policymakers' attentions to help make change?
Absolutely. So you're absolutely right. Right here in Georgia, we actually lead the country in maternal deaths, and it's frightening. But I want to just highlight some wins that we've had recently. So just this year, one of the big things that lawmakers could have done, and that we actually accomplished here in Georgia, is we expanded postpartum Medicare, Medicaid to a year postpartum. It used to be just 2 years ago, only 6 weeks. And so what was happening is that after 6 weeks, mothers just weren't able to access care, and they were having complications that ultimately were sometimes catastrophic and far too often fatal. So we've done that. That's big. What we are looking to do now is, particularly in Georgia, is close access to quality care. One of the challenges we have here is that 37% of our counties have zero obstetrical care, right? That's scary. And so we're working with both private and public partners to kind of close those gaps. But from a lawmaker standpoint, we are working very closely with legislators here in Georgia to further pass legislation that will expand access to care, widen access to telehealth, and also make providers more accountable for the quality of care, make sure they're centering compassionate, dignified care. But on the federal level, we are working on something that we're extremely proud of, and that is called the Black Maternal Health Momnibus. It is a federal package of 13 different bills comprised to make the Momnibus bill, right? And these bills address everything like social determinants to change. Social determinants to care. Um, how climate change and environmental factors are affecting mothers, um, how we can make technology more accessible. And within that package of bills is the Kira Johnson Act, named for my late wife, that is going to make sure there's funding specifically earmarked for community-based women of color-led organizations that are in the communities catching the babies. Um, and so one of the things that you can do, or anybody out there, you can go to our website, forcure4moms.com. You can take 30 seconds, sign the petition. All you got to do is put in your first, your last name, and your zip code. We will automatically generate a letter that will go to both of your U.S. senators and your congressmen and the White House, demanding that they pass this legislation and take action to support moms and babies.
That's incredible. I want to ask you and kind of take a deeper dive into maternal health and maternal mortality.
Yeah.
What are some commonalities we see in this health field? Because I feel like much of women's health kind of always feels like a bit of a mystery, especially
Sure.
for me. I talk to so many health professionals, and I feel like I always learn something new. So I just want to, kind of dive into this one a little bit and see what are some common threads we see in maternal mortality.
Sure, that's an excellent question. So I spend a lot of time, and as an organization, we spend a lot of time supporting families that have been impacted by maternal mortality and morbidity. So not only families that have lost moms, but families of women who have nearly lost their lives. And the common thread that we see, unfortunately, is that they weren't heard and they weren't prioritized. It's the same thing over and over again. Somebody expressed their concerns were dismissed, they were denied, they were delayed, and by the time they finally did something, it was too late. And that's regardless of color, that's regardless of socioeconomic, geographic. That is one of the common threads. And so, on top of all of the other issues that are creating this, we have to um, make sure that women are being heard, right? That providers understand that there is nobody that knows this woman's body better than she does, right? Even if we look at somebody like Serena Williams who had a near miss death, she begged and pleaded for them to give her a CAT scan and was nearly too late. And so it's time and time again, women's concerns aren't being validated, they're being dismissed, and it's the inability to validate and prioritize those concerns is oftentimes becoming fatal. So that's one of, unfortunately, the many, I mean, one of the common themes that we're seeing far too often.
Why do you think this happens?
If I'm really being honest, which is the only way I know how to approach things, um, it is indicative of how our society views women and prioritizes them. I'm just being frank. And even when we talk about this issue, the simple fact that this maternal mortality crisis is existing in our society is a reflection of how we value women, right? And the reality of the situation is that over the past 50 years, we are the only industrialized country whose maternal mortality crisis has steadily risen while everybody else's has steadily dropped. And so, one of the things that we do our best to frame for whether it's lawmakers, stakeholders, corporations that want to get involved in this work is this is not a women's health issue. This is not a black women's issue. This is not a Latina issue. What this truly is it's a human rights issue, right? Every single family in our country deserves the right to a safe, dignified birthing experience, period, as a fundamental human right. And the reality situation is we can look at other countries that have taken steps to improve outcomes and we can do it. So I really, even though these numbers are infuriating, I am confident and more confident than ever that sooner than later we will be looking at this maternal mortality crisis in the historical context.
What would you say is like a key standout factor in between US birthing processes versus these other industrial countries? But what is an easy new practice that can be adopted to kind of start making a change?
So I think that one of the big differences is the US medical system puts profits over people,
Yes.
right? It is simply greed. And um, I think that two things I think that we can do quickly and we will see a drastic change is if we can prioritize and widen access to midwifery care and doula care, that will go a long way. If we look at other countries who have centered midwifery care over, gross hospitalization, their rates are much more in check. And so, and let me be clear: I'm not anti-doctor, I'm not anti-hospital, but I am anti-unnecessary intervention. I am anti, medical establishment forcing women into procedures that they don't necessarily need. Because what we see is that the more interventions you have, those all end up being line items on your bill. Subsequently, if we look at the cesarean rate in the United States over the past 50 years, goes through the roof. Simultaneously, if you took a graph and you looked at the maternal mortality and morbidity rate, it mirrors that. And so in the United States, oftentimes hospitals are looking at how can we get this mother out in the shortest time and charge her the most money. And unfortunately, with cesareans and all these interventions, that's the way it's been done. And so um, we have to put things in place to be able to mitigate that.
Absolutely. I mean, this is just such a really a mind-blowing conversation to me. It just I knew things in the US were very difficult for women for having children. I just before really talking with you and doing my research myself, I just didn't realize how expansive and deep this topic was. And it just my mind, I'm just like, whoa, like this is like a really deep issue. And it's
Really
incredible
is.
just how far down the list it goes and how interconnected it is to other health care, like attributes and other parts of even in the political sphere of things. So it's really incredible just to, hear all of this. Now, I do kind of want to lighten up a little bit. You've got an event coming up that is meant to educate and have fun. And that is always the best way to teach people is through having fun and getting out in the community. So I want to talk about this a little bit. You've got the Black Maternal Healthcare Week community block party coming up. So
Absolutely.
let's dive into this and let's kind of change our pace a little bit so we're not about to
Sure.
cry any second now because I can feel the
No, no, no,
tears
no,
like
no,
swelling
no.
up in my
Listen.
eyes.
Well, look, let's talk about it. Let's talk about some good news. So here's the thing. Um, we know about the statistics. We know about the trauma that this maternal mortality crisis has inflicted on families like mine. But this Black Maternal Health Week, we are focusing on reclaiming the joy in birthing, on focusing on looking towards the future and shaping and grabbing what is possible. And so, one of the things that we did, and I'm so grateful to have the city of Atlanta as a partner, is we reached out and we connected with the city of Atlanta. And so, big shout out to Mayor Andre Dickens, his Office of Constituent Services, for partnering with us. And so what we're going to do is we're going to have a celebration. We're going to have a community celebration. We're going to have a block party. It's going to be Saturday, April 15th at the MLK Rec Center and Auditorium. And it's going to be an opportunity for folks to come out. We're going to have lots of giveaways. We're going to have free diapers, baby food. I mean, Huggies, Gerber, all these amazing sponsors are going to contribute. We're going to have workshops. So if you ever wondered about how to become a doula, come on down. If you wanted to understand how to connect with the doula, come on down. We're gonna have workshops around fatherhood and how you can better support your partner in the birthing process. We're gonna have games for the kids, bouncy houses, free food, and then also to be opportunity to connect people in the community with these resources for birthing classes, postpartum depression, like I said, fatherhood resources. Um, Anything that you can think of. We'll have amazing advocates, amazing community partners out there. We'll even have complimentary therapy sessions, right? To help people who've dealt with birth trauma or maybe just dealing with loss. And so it's really an opportunity for us to uplift the work of a lot of other amazing people and community advocates and organizations that are here to serve and connect folks in the community with them. It's completely free for everybody. I would strongly urge for you to pre-register so you can make sure that you reserve your giveaways because this stuff is going to go quick. But still come on out and have a good time. But if you go to 4cure4moms.com, just click on the link, enter your name, let us know that you're coming. We can put all your giveaways to the side. So the number 4, KIRA, the number 4, once again, MOMS.com, 4cure4moms.com. Register, come on out, bring the whole family. It's going to be a lot of fun. We're expecting sunshine, but we will have a great time, rain or shine.
Incredible, incredible. Charles, how can people stay up to date with you or find out more
Yeah.
about maternal mortality and like get more information on what you're doing in the community?
Absolutely. Thank you so much for that. So you can follow us on all social media at 4Cure4Moms, the number 4, once again, KIRA, the number 4, MOMS. You can go to our website, same thing. We're always posting resources, how people can get involved, how they can support, how they can be more informed if they're going into the process. And my only ask of your listeners is if you would share this information with your friends and family, right? You may not be prepared to start a family, that's fine, but chances are you know somebody that is. So we want everybody to go into this with all the information, all the resources they need to make sure that they have the birthing experience they deserve.
Incredible. One last question for you, and that is what would you say is one tip, trick, or tool that a mother, a couple can take with them into the birthing process to make sure their voice is being heard? What can they do? Is there a certain phrase they can say? Are there certain keywords they can try using to just empower them and be able to also communicate clearly with any type of medical staff?
Absolutely. So, um, every single birthing center or hospital has what's called a patient's bill of rights. You can go on that hospital's website. If it's not easily accessible, you can ask your provider to provide it for you, right? I would print that out in advance and take that with you so that you have it and the family and team around you that's prepared to advocate for you has it. And what that patient's bill of rights will say is it will clearly state what your rights are in the event that you do not feel seen, heard, or prioritized, how you can elevate, request, or demand a second opinion. So that's one simple thing that I advise all folks to do, is to find out what your hospital or your birthing center's patient bill of rights is and make sure that everybody around you is aware of that. Sometimes I advise families to print it out and maybe post it on the wall. It speaks volumes.
Incredible. That is such an incredible tip, and it just helps us be able to combat this problem just in a small way, shape, or form on the personal front. So again, Charles, thank you so much for joining me. This has been such an informative conversation. I'm definitely looking forward to sharing all the information I've learned today with my friends and family. And of course, guys, thank you so much for joining us. And if you want to stay up to date with me and all the interviews and cool things I'm doing just like this, you can follow me on all social media at itsme_Alyssa D. Charles, thank you again so much for joining me. It's been a pleasure talking to you, and really just such an informative, great conversation. Thank you.
Awesome. Thank you so much. We'll see you Saturday. Can't wait.
Yes, I
All
will
right.
do my
Awesome.
best to
Thank you
make it
so
up
much.
there.